One of the things that I recently looked at that I think is real helpful is a mnemonic that I became aware of, and is path warm. I is for ideation, any kind of suicidal ideation, any thoughts of suicide, not wanting to live anymore, life's not worthwhile, any of that. Substance abuse, any kind of substance abuse. I want to point out that it's not just street drugs, it can be alcohol. Sometimes people are abusing prescription drugs as well. So people need to be paying attention to that, or if they're changing the drug or the alcohol or substance that they've been using. May also be another indication. P for purposelessness, feeling like there's no purpose in life, they don't have any worth, there's nothing that they can do, no one needs them, they have no future. A for anxiety, increased feelings of anxiety. T, feeling trapped, that there's just no way out, they're just in a lot of pain and they can get no relief. H for hopelessness, really just feeling like there is no hope whatsoever, that there's no way, again, feeling that trapped, no way out, no sense of hope. W for withdrawal, maybe withdrawing from family and friends, more withdrawn from activities that they've normally engaged in. A for anger, maybe increased sense of anger or irritability. Sometimes not full-blown anger, but increased irritability may also be a signal. Recklessness, maybe engaging in high-risk behaviors, driving real fast, maybe engaging in other behaviors that may be really risky. And then M for mood changes, and if their family members or friends are noticing mood changes in this individual, they may be easygoing and now they're pretty irritable, or other kinds of signs. Some of the other things that you may see also, sometimes once people have decided that they are going to kill themselves, they may have a sense of calm. That you may have had a period of depression and real sadness, and now you get this sense of calm, and it may be that they have come to the point of deciding that they really have made the decision that they're going to kill themselves. Well, they first really need to give them, pay some attention to them, let them know that they care about them and that they're concerned about them and that they're here for them and they're willing to get help for them, that they're not alone. They don't have to try and fix everything, but recognize that the person needs some help, and it's more help than they can provide in most cases. And so their willingness to go with them, if they're afraid, if the person is afraid to go get help by themselves, that they're offered the willingness to go, and that they're not minimizing what the person is saying. That's really important.
It's also really important for them to ask very directly, are you thinking about killing yourself? Mm-hmm. Are you thinking about hurting yourself? Right. Don't be afraid to ask the question.
Yeah. I think there are some people who think, well, if we talk about suicide, that'll make it worse. It won't make it worse. Ignoring it is more of a problem than actually talking about it. So being real direct about, yes, are you committed, or are you thinking about suicide? How long have you been thinking about suicide? You think about ways to commit suicide. All of the information you can get, better. The more information, the better.
Well, they can certainly call the Crisis and Information Center. That number is 589-4313. There's also a National Suicide Hotline as well.
The National Suicide Hotline is 1-800-273-8255. We at Our Lady of Peace have a Crisis and Information line. That's 451-3333. They can also dial 911. We need to move quickly and not wait if there's any kind of concern. But certainly if a family member wants to call one of the crisis lines to get some information, that's always important to do.